If you spot a new gray hair in the mirror or, maybe a wrinkle forming around your eyes, you know exactly what aging looks like.
Right, yeah, it's highly visible.
Exactly. It's easy to categorize. It's something you can point right to. But right now, for millions of women, there's this entire microscopic ecosystem undergoing a massive structural collapse. And it is happening completely out of sight.
Completely out of sight, yeah.
We aren't talking about surface-level cosmetic changes here. I mean, we are talking about a biological factory that is slowly shutting down, leading to severe physical consequences that are, unfortunately, often suffered in silence.
It's a profound and systemic shift.
Mm-hmm.
And because it happens internally, specifically within the female reproductive system during menopause, the visual simplicity of aging just completely vanishes.
Yeah, you can't just look in the mirror and see it.
Exactly. The physical symptoms become impossible to ignore for the patient, yet the underlying cause remains largely invisible to the naked eye.
Which is why we designed this deep dive specifically for you. The goal here is to feed your curiosity and get right to the bottom of a highly complex medical topic that honestly affects so many but is understood by so few.
So true.
Our mission today is to understand the microscopic cellular mechanics of vaginal atrophy. We are going to look at exactly how, and more importantly why, the ratio of something called parabasal to superficial cells completely shifts on a maturation index during menopause.
Yeah, and looking at the stack of sources we have today, I mean, we've got detailed medical texts, clinical protocols, and pharmacological reviews. It becomes glaringly obvious that while menopause is this ubiquitous topic, the actual cellular and structural changes are rarely explained.
Barely touched on, yeah.
Right. Clinically, this is known as the genitourinary syndrome of menopause, or GSM. And we hear a lot about the symptoms of GSM, but almost nothing about the cellular architecture driving them, or the cause and effect relationship happening at that microscopic level.
Okay, let's unpack this. Before we can understand how this entire cellular environment shifts and breaks down during atrophy, we really need to establish what the baseline normal looks like.
Right, the healthy state.
Yeah. What does a healthy estrogen-rich vaginal environment actually look like under a microscope?
To get a clear picture of that, we have to look at the specific anatomy of the tissue. I mean, the vagina isn't lined with tough keratinized skin like your arm or your hand.
Right, because keratinized skin has that tough, dead outer layer to protect against the environment, right?
Exactly. The vagina, instead, is lined with a really delicate mucous membrane called a non-keratinized epithelium. Because it lacks that tough outer armor, it has to rely on a completely different, highly dynamic system for protection.
And this non-keratinized epithelium isn't just like a static wall of cells. The sources describe it almost like this highly organized, bustling biological production line.
That production line analogy is perfect, actually. In a healthy premenopausal environment, this tissue is constantly producing three main types of cells, and they represent three distinct stages of maturity.
Okay, walk us through those stages.
So deep down at the very base of the tissue, you have the parabasal cells. These are the immature foundational cells.
Like the raw materials at the start of the line.
Basically, yeah. Then, sitting just above them in the middle layers, you have the intermediate cells, which are mildly mature. And finally, lining the very top surface of the vaginal wall, you have the fully mature superficial cells.
So it literally sounds like an assembly line where a cell starts at the bottom and just gets pushed to the top as it matures.
That's exactly what happens.
So what is actually driving that line forward? What keeps the factory running?
Estrogen. Estrogen is the engine of this entire process. Yeah, the hormone basically acts as the manager of this factory, constantly stimulating those deep, immature parabasal cells to divide, differentiate, and move up through the layers until they become those fully mature superficial cells at the surface.
But the sources highlight something really specific about those superficial cells. As they mature and get pushed to the top, they're doing something strange. They're storing massive amounts of glycogen within their cell walls.
They are.
And glycogen is basically just a form of stored sugar, right? So why is a cell on the vaginal wall hoarding sugar?
Because they are preparing to feed the local microflora. This is where the biology becomes incredibly elegant.
Elegant, ow.
Well, when those mature superficial cells naturally reach the end of their life cycle, they shed from the surface of the vaginal wall and break open. And all of that stored glycogen is released directly into the vaginal canal.
Oh, wow. So they are essentially packing a lunch and then offering it up to whatever is living in that environment.
Yes. And what lives in a healthy environment is a heavy colonization of good bacteria, primarily lactobacillus.
Okay, the good guys.
Right. The lactobacilli consume that released glycogen. It's their primary food source. And as a byproduct of metabolizing that sugar, the bacteria produce lactic acid.
Which acts as a chemical defense system.
Precisely.
The lactic acid keeps the vaginal pH highly acidic, usually right around 3.5 to 4.5. I imagine that level of acidity is incredibly hostile to outside pathogens.
It creates an environment where harmful pathogens, enteric bacteria and
Yeah.
yeast, simply cannot thrive. The acidity just completely locks them out.
That is wild. The human body is essentially operating a symbiotic farming mechanism.
That's a great way to put it.
I mean, it is intentionally cultivating and feeding a bacterial security force using sugar, just so those bacteria will manufacture an acid moat to protect the tissue.
If we connect this to the bigger picture, the sheer interconnectedness of it is staggering.
It really is.
This tiny, microscopic cellular function, a single hormone driving cell maturation, which releases sugar to feed a specific bacteria, to create a specific acid, is entirely responsible for the macro-level health and defense of the entire organ.
It's a house of cards almost.
It is. The tissue maintains its thickness, its elasticity, and its immunity through this perfectly balanced, highly dependent ecosystem.
But then menopause happens, and estrogen, the hormone running this entire factory, effectively leaves the building.
We all know the symptoms women experience, but biologically, what is actually happening to this perfect ecosystem when that estrogen stimulation is suddenly gone?
The entire assembly line just grinds to a halt. As systemic estrogen levels drop, the epithelium ceases its prolific cell division. The maturation pipeline just stops.
So the factory shuts down.
Exactly. Over time, because no new cells are being pushed upward to mature, the vaginal wall is no longer lined by those thick, mature, superficial cells. Instead, the wall thins out dramatically, and the surface becomes lined almost entirely by those deep, immature parabasal cells. And wait, if those surface cells are immature parabasal cells, they never went through the maturation phase where they hoard sugar,
Right.
so the glycogen supply just vanishes.
That loss of glycogen is the fatal blow to the ecosystem. Once the sugar is gone, the lactobacilli starve.
Oh no.
Yet the bacterial colonies die off in massive numbers. Without the lactobacilli producing lactic acid, the vaginal pH starts to rise rapidly.
So the acid moat dries up.
Completely. It climbs out of that protective 3.5 to 4.5 range, crossing above 5.0 and often hitting 6.0 or even higher.
The security system fails completely, leaving the tissue highly susceptible to urinary tract infections and vaginal infections. But, I mean, this isn't just a chemical shift, is it? The sources are very clear that the physical architecture of the organ undergoes a massive alteration.
Anatomically, the changes are severe. Without estrogen maintaining the cellular volume, the vagina literally becomes shorter and narrower.
It physically shrinks.
It does. It loses its rugae, which are the natural accordion-like folds in the tissue that give it the ability to stretch and expand. The mucosa, the lining itself, becomes pale, incredibly thin, dry, and highly friable.
Friable meaning it tears easily.
Very easily.
Mhm.
Clinicians will often observe petechiae during a routine exam.
What are those?
They're tiny pinprick blood spots that appear on the tissue simply from the gentle friction of a cotton swab or a speculum. The tissue is that fragile.
Wow. And this translates to the severe symptoms of the genitourinary syndrome of menopause: intense dryness, chronic irritation, urinary urgency, and dyspareunia, which is severe pain during sexual intercourse.
Yes, exactly.
But I want to push back on this for a second because the terminology could be kind of confusing here.
Okay, what do you mean?
Well, if the cells are just reverting to a state of being immature parabasal cells, why does that cause so much physical pain and tearing for the patient? I mean, immature just sounds like they are young or underdeveloped, not inherently painful, you know?
Yeah. That is a really vital distinction to make, and it all comes down to tissue thickness and structural integrity. The parabasal cells themselves don't inherently cause pain.
Right.
The pain comes from the fact that the physical architecture of the wall has been entirely compromised. Think back to our factory analogy. When estrogen was present, you had a thick, robust wall built of multiple, dense layers of cells, topped with durable, mature superficial cells that were naturally leukoplated.
So it was thick, pliable, and well cushioned.
Exactly. When estrogen drops and maturation stops, you lose all those upper layers. The wall becomes paper thin. You are leaving raw, delicate basal tissue totally exposed to mechanical stress.
Ouch.
Yet there's no cushion, no elasticity, and no natural moisture. So any form of friction, whether it's from intercourse, tight clothing, or even just daily movement, causes micro tears in that fragile layer.
Because the nerve endings are closer to the surface since the tissue is so thin.
Exactly. It's a true structural collapse of the organ, not just a cellular downgrade.
That paints a very vivid and, frankly, painful picture. The physical sensation of GSM makes complete sense when you realize the protective armor is just, it's gone.
It's completely gone.
So if a doctor needs to evaluate this structural collapse, how do they objectively measure it? Because relying entirely on a patient trying to subjectively describe their pain or dryness isn't exactly precise for clinical medicine.
Right. Medical professionals use a specific diagnostic tool called the vaginal maturation index, or the VMI.
The VMI.
It is a cytological test, meaning it looks specifically at the cells themselves. During an exam, a clinician uses a small brush or spatula to take a gentle smear from the upper one-third of the lateral vaginal wall.
And then what?
They send that smear to a cytology lab, where a technician will place it under a microscope and count exactly 100 epithelial cells.
Here's where it gets really interesting, because they don't just count the total number of cells to see if there are enough of them, right? They categorize every single one of those 100 cells to create a very specific mathematical ratio.
Exactly. They categorize those 100 cells into our 3 distinct types:
Right.
parabasal, intermediate, and superficial.
The 3 stages of the assembly line.
You got it. The result is always written as a 3-number ratio, read from left to right. The percentage of parabasal cells, the percentage of intermediate cells, and the percentage of superficial cells.
It's almost like a demographic census for a city. It tells you exactly who lives there, how many infants, how many teenagers, and how many adults.
I love that comparison.
So if a healthy city is mostly adults, what does that ratio look like on the VMI?
A healthy, highly estrogenic environment like you would see in a woman in her 20s or 30s might show a VMI of 0.307.
Okay, let me break that down.
So that means 0 parabasal cells on the surface, 30% intermediate cells, and 70% fully mature superficial cells.
Oh, wow. So it's heavily weighted toward the mature cells.
Right. It is a very healthy right-heavy ratio indicating massive cellular maturation.
But then we look at the demographic census during early menopause. The estrogen drops, the factory starts pushing cells forward, and that ratio shifts dramatically.
It really does.
The sources say a typical early menopausal VMI might look something like 65305. Suddenly, 65% of the cells found on the surface are those immature infant cells, the parabasal cells, and only 5% are fully mature adults.
And as the atrophy progresses into severe states, those superficial cells will drop below 5%, and the smear becomes predominantly, sometimes almost entirely, parabasal cells.
It just completely flips.
In clinical medicine, this progression is universally referred to as a shift to the left. The high percentage numbers migrate from the right side of the ratio, the superficial cells, all the way over to the left side, the parabasal cells.
I think of it like a credit score for vaginal health, honestly.
Yeah.
A single set of numbers that immediately tells a doctor the exact state of the local cellular economy. So a doctor looking at a piece of paper doesn't even need to see the patient to know what they are experiencing.
Right.
That shift to the left is the literal mathematical footprint of vaginal atrophy.
It is the definitive biological marker. In fact, many of the clinical studies in our sources use a specific VMI cutoff value to definitively diagnose an estrogen-deprived state.
What's the typical cutoff?
Often, a superficial cell value of 50% or less, and in some protocols, a maturation value of less than 40% is used as the hard cutoff. If the numbers fall below that line, the tissue is officially categorized as being in a state of atrophy.
So if a doctor sees this VMI ratio drop to 65305, they know the tissue is collapsing. But that raises a massive problem for clinical trials, doesn't it?
How so?
Well, if a pharmaceutical company creates a new treatment for GSM, how do they prove it actually rebuilds the wall, rather than just acting as like an overpriced moisturizer?
This is why the VMI is absolutely vital in pharmacological research. If you want to prove that a therapy actually reverses the genitourinary syndrome of menopause, you can't just rely on subjective symptom scores.
Right, because patients might report feeling less irritation just because a cream is soothing.
Exactly. But the tissue underneath could still be dangerously paper-thin, lacking glycogen, and highly prone to infection.
Pain is subjective, and lubrication can be artificial. A moisturizer doesn't rebuild a cellular wall.
Which means objective markers are strictly required by organizations like the FDA. The sources point out that an abnormally high vaginal pH, anything above 6.0, highly correlates with having elevated parabasal cells, usually over 20%.
Okay.
So checking the pH is a great rapid screening indicator. But to truly prove a treatment is structurally working, You need to see the VMI ratio physically shift back to the right.
Right back to the adults. The sources give a really clear example of this process in action using a treatment called Vagifem, which is a local estrogen therapy. It is delivered directly to the vaginal tissue rather than taken orally.
Yes. In one of the foundational FDA submission studies for Vagifem, patients with severe vaginal atrophy were given a highly localized 10 microgram dose for 12 weeks.
And what did their baseline look like before the treatment?
At the start of the study, their baseline VMI showed that parabasal cells comprised over 40% of the total cell count. That is a clear, undeniable indicator of severe structural collapse.
A massive shift to left.
Exactly.
But after 12 weeks of treatment, that tiny dose of local estrogen restarted the biological assembly line. My question is, how? I mean, if the tissue is dormant and the cells are immature, how does adding estrogen suddenly force them to grow?
Well, even though the tissue is dormant and severely atrophied, those deep parabasal cells still possess estrogen receptors.
Oh, they do.
Yeah, they're essentially waiting for a signal. When the localized estrogen from the Vagifem treatment is applied, the hormone binds to those dormant receptors.
Like a key turning a lock.
Exactly.
Yeah.
That binding process literally sends a signal into the DNA of the cell, telling it to reactivate, begin mitosis, and resume the maturation pathway. The cells wake up and start dividing again.
That is incredible. The cells are just lying dormant, waiting for the chemical key to turn the factory back on.
What's fascinating here is the sheer speed of that biological reaction. The study showed a 37% reduction in parabasal cells compared to the placebo group.
In just 12 weeks.
Yes. By simply reintroducing that local manager, the atrophic epithelium shifted from a predominantly parabasal cell population back to a superficial cell population typical of premenopausal women.
Wow.
You are observing a tissue reverse its aging process and rebuild its structural integrity on a microscopic level in a matter of weeks.
But it makes me wonder about the clinical practicality of all this. If checking the pH is so much faster, I mean, a doctor can just use a little strip of pH paper right in the office. Why do researchers and clinicians rely so heavily on the VMI?
That's a fair question.
Because if a high pH tells you the security system is down, isn't that enough to confirm the problem?
pH is an excellent rapid screening tool, but it's ultimately an indirect measurement of the root problem. A high pH tells you that the lactobacilli aren't producing lactic acid,
Right.
which likely means they don't have enough glycogen to eat, which likely means you lack mature superficial cells. But the VMI cuts out all the biological guesswork. It provides a precise, undeniable percentage of cellular maturation that pH alone simply cannot offer.
It's the difference between guessing the factory is broken because no delivery trucks are leaving the gates versus walking onto the factory floor and physically counting exactly how many machines are shut down.
The VMI gives you the exact inventory of the factory floor. It ensures that a medical treatment is genuinely healing the tissue architecture, rebuilding that thick, elastic, glycogen-rich wall, and not just temporarily masking a symptom or artificially lowering the pH without fixing the underlying cellular collapse.
So what does this all mean? Let's bring this entirely together for you. When we talk about vaginal atrophy and the genitourinary syndrome of menopause, we aren't just talking about a minor inconvenience of aging or simple dryness. We are talking about a profound microscopic structural shift.
Absolutely profound.
The loss of systemic estrogen essentially fires the factory manager, bringing the cellular production line to a grinding halt. This causes a massive shift to the left on the maturation index, where the tissue goes from being populated by thick, mature superficial cells to being dominated by thin, immature parabasal cells.
The infants take over the city.
Exactly. The glycogen lunchboxes disappear, the bacterial security force starves, and the protective acidic ecosystem is completely destroyed.
And understanding the biological cascade equips you, or someone you care about, to view the symptoms of menopause through a totally different lens.
It really does.
It is not some inevitable, mysterious decline that just has to be endured in silence. It is a measurable, completely understandable, and highly treatable cellular mechanism.
It takes the stigma and the unknown out of the equation and puts the reality right under the microscope. But before we wrap up, I know you always like to leave us with a broader question to chew on. Based on everything we've uncovered in these sources, what is one final thought we should take away?
Well, we've established that the entire vaginal ecosystem, the thickness of the tissue, and its protective microbiome, all rely heavily on the glycogen provided by those mature superficial cells.
Right, the sugar.
And currently, the gold standard is using local estrogen to force the parabasal cells to wake up and mature into superficial cells. But this raises a highly provocative question for the future of non-hormonal medicine.
Oh, I like where this is going.
Could future therapies skip the estrogen pathway entirely? If the ultimate goal is maintaining tissue health, feeding the lactobacilli, and preserving that acidic environment, could science find a way to directly deliver glycogen to the parabasal cells, or perhaps directly feed the microbiome itself?
Wow.
Could we artificially mimic a robust premenopausal state without ever needing to introduce a single hormone?
Bypassing the factory manager entirely and just delivering the raw supplies directly to the security guards. That is a brilliant thought to end on, and a perfect reminder that even when the structural foundation of a biological system seems to be crumbling, science is always looking for a new, innovative way to rebuild it. Thank you so much for joining us on this deep dive into the microscopic world of cellular health. Stay curious, keep asking questions, and we'll catch you on the next one.